Now I want to talk about narcolepsy. And narcolepsy is a disorder that has been really misunderstood over a long period of time. What exactly is narcolepsy? Narcolepsy is a disorder of excessive sleepiness, but I don't look at it as just a disorder of excessive sleepiness. There are times that it's normal to have some degree of sleepiness. However, there's times when you're trying to function and the sleepiness is beyond our control, and that can be abnormal at times. So I don't just view narcolepsy as a disorder of sleepiness in itself, but also as a disorder of problems with regulation of sleep and wake. More specifically, REM sleep. And you can have intrusions of REM sleep during our daytime. Now, some symptoms of narcolepsy that we can see. We can have sleepiness. We can also have cataplexy or low muscle tone that occurs during our daytime. You can also have some REM type symptoms such as sleep paralysis, where you're awake, you know you're awake, but your body can't move, almost like you're paralyzed. And you can also have some hallucinations. They're called hypnagogic or hypnopompic hallucinations, which means as you're going to sleep or as you're waking up, you can see vivid dreamlike images that aren't there. And another symptom that we commonly see actually is insomnia, or difficulty sleeping during the evening. And there's a number of different reasons for this. Now, the way that we evaluate for narcolepsy is first we do a sleep study to make sure that nothing is going on that's causing the sleepiness over the evening. And then if there isn't an obvious reason for the sleepiness during the evening, we do a multiple sleep latency test, or a test that takes a look at the degree of sleepiness, and we look for 2 SORMs or more if we have that. There's also a blood test that can be helpful sometimes, sometimes not. And additionally, there's also a spinal fluid test that sometimes we can use to help diagnose narcolepsy. So, do we have that clear? Probably about as clear as mud. Making a key point. To understand narcolepsy, you can't just read a definition from somewhere. You have to understand what's going on in normal sleep, normal daytime as well. So let's take a number of steps back. So very early, we showed what normal sleep is during the evening. And one of the things that we showed was our REM sleep. And we mentioned a couple things about REM sleep, rapid eye movement sleep, our dream sleep. And indeed, just that, number 1, you are dreaming, but number 2, our muscle tone is low, almost as if we're paralyzed. And that is protective, so as we're sleeping, we don't actually act out our dreams. Now, another key thing that we said is that our first REM period, our first dream period, actually normally doesn't come until after an hour of sleep, about 90 to 120 minutes. So now the way that we evaluate for narcolepsy is we do a sleep study first and make sure that there's not something obvious that's causing some daytime sleepiness. Now, if we didn't find a particular reason to have the sleepiness, then many times the next day we go on and we do an MSLT, or a multiple sleep latency test. The name isn't important. The concept is that we have someone take 5 naps. Now, if they don't nap, and some people may say, well, how are you going to nap in 5 naps? And if you say that, then you probably don't have a disorder of sleepiness. But the concept is that we can objectively measure this. We know what parameters are normal. This has been done on people who don't have sleep disorders, or they have sleep apnea, or they have narcolepsy, or different sleep disorders. And we're able to objectively see the degree of sleepiness. If on average, during these 5 naps, it takes them 15 to 20 minutes, that's normal. If it takes them about 10 to 15 minutes, that is a mild sleepiness. 5 to 10 is a moderate sleepiness, and less than 5 minutes on the average is a severe sleepiness. So again, it is 5 multiple naps, sleep. How long does it take to get the sleep latency? And we have normal parameters. We have normative data. Test, MSLT. Now, coming back to what we mentioned in regards to REM sleep, that you normally don't get your first REM period until after an hour of sleep, until after about 90 to 120 minutes. Now, if we're taking a 20-minute nap, should you see REM in that 20-minute nap? No. And that would be pretty fast. That would be sudden, as a matter of fact. and it would be sudden onset of that REM period. And that's one of the things that we do to look for narcolepsy, is we look at the SORMs, sudden onset REM periods. And in a patient with narcolepsy, they may have 2 or more of these sudden onset REM periods. And the parameters that we use is that if someone is falling asleep within an average of 8 minutes and they have 2 or more of these sudden onset REM periods, and there's not an obvious sleep disorder overnight that's causing this, that's enough for the diagnosis of narcolepsy.